Inflammation is when the immune system is revved up, and it's beneficial when it is against things like cancers in the body and infections in the body, but it can also cause damage to the tissues of the body, especially when it's chronic, and result in a lot of disease conditions. This is a cornerstone in the aging process. Inflammation can be worsened because of your genetic tendencies, your environment, but also the foods you eat. A lot of convenience foods contain preservatives and other chemicals to either make them taste great and make you go get more of them over time, but also help them stay long enough to be purchased. Those chemicals and preservatives get into your system, get processed, and can become, over time, drivers of inflammation in your system that can show up in different organs, including the skin. So having an anti-inflammation diet, which is simply cutting down on processed foods significantly, cutting down on high sugars and high carbs, can help with this process. Why sugars and carbs? Carbs become sugar in your body. So especially the processed carbs, the white breads, potatoes, pastas, rice, all of those are delicious, but they can be in excess processed to excess sugar in your body. And when you have excess sugar in your body, the sugar wears out the insulin process, and you now become at risk of developing insulin insensitivity. When your body is no longer sensitive to the hormone called insulin, which gets rid of the sugar in the blood, the sugars in the blood stay for a long period of time and have time to stick to different proteins and different components of tissues. And when they are stuck to those tissues, the immune system sees them as things that shouldn't be there and fights. That is called inflammation. That inflammation now starts destroying those tissues little by little over time. That's why we end up with different conditions of aging, such as diabetes, blood pressure issues, high cholesterol, liver disease, kidney disease, brain disease, dementia, skin diseases, eye diseases, nerve-related diseases. There are lots of different organs that can be affected by this high sugar destruction. In a previous post, I compared sugars to hyper 2-year-olds. When you have a few of them, you have a good chance of controlling them, you being insulin. I use this analogy in clinic, which I hope can help you better understand this. Now, when you have a little bit of sugar, your body can better control it. Insulin can better use it for energy. But like the 2-year-olds, when you have a gym full of 2-year-olds and you're the only person to control them, you will not find an easy way around that. And at some point, you may even give up and say, I'm over this, right? And so the hyper 2-year-olds are not listening. They're busy tearing things down, hurting each other. You can't reach every single one. In the same fashion, when you have an excessive sugar in your diet, you wear out your insulin apparatus in your pancreas, and now you risk insulin insensitivity or insulin resistance. So I kind of imagined the adult trying to control the hyper 2-year-olds in the gym, jumping around, destroying things, just giving up, throwing their hands up, going in the corner, and almost in a fetal position, trying to get their sanity back. And so the 2-year-olds are free to do whatever damage they're able to do. In the same fashion, the sugars now float around, causing damage to different tissues versus being taken in through the mechanism of insulin into the cells to be used for energy. May not be a perfect example, but it's just something I say in clinic to help patients better understand how high sugars can be harmful or even toxic or poisonous.